Bom, nós temos a oportunidade de entrevistar o professor Barham Abu Dayyeh, que é endoscopista e pertencente ao Mayo Clinic, Rochester. Professor Dayye, it's very nice to have you here.
Thank you.
And I would like first to ask you about your impression of the course and the meeting that you are attending and participating with so much importance for us.
Absolutely. The course has been fantastic. The caliber is as good of any international course I've seen, even better. The caliber of cases, the breadth of pathology and expertise available was amazing. There was a multidisciplinary team and the course was just fantastic.
Well, thank you. I want to thank you once again for your participation. And related to the endoscopic approach, what could you tell us about the endoscopic approach to infected pancreatic necrosis? We had a session here, but we didn't have time enough to discuss. So if you could just give us a brief message.
Sure. The brief message is, as you know, the more minimal invasive approaches to these problems are being shown to be better for the patient as far as outcomes. And that's what we've been practicing at the Mayo Clinic. And we approach necrosectomy through an endoscopic approach, and we've been very successful with that, with very low incidence of mortality and morbidity.
Wow. And another point, if you're an expert in that area too, it's the endoscopic ultrasound. What is the position of the indications for endoscopic ultrasound with patients with pancreatic cancer?
The ultrasound, I think it's a very useful tool for pancreas cancer. One is to aid in the detection of small lesions that are not seen on CT scan. As we know, if you find pancreas cancer early, you could impact survival and offer appropriate surgery. The other thing is to obtain tissue if the patient would need neoadjuvant or if the patient is non-surgical, to treat the patient with chemotherapy or radiation. It also offers the role for enhanced staging. A lot of times we get a patient that the CT scan showed a resectable disease, especially in the liver, in the celiac ganglia, in a malignant ascites, or in the mediastinum. So I think that's a useful role. In the future, things to look forward to in ultrasound is treatment of pain in the setting of pancreatic cancer. Pain is a big issue, especially for non-resectable disease. We've been doing celiac neurolysis, where we inject alcohol to destroy the nerves causing this pain. And we are doing novel therapeutics for unresectable disease, where my colleagues at the Mayo Clinic do inject chemotherapy directly into the cancer in order to treat non-resectable cases.
Well, thank you very much.
Absolutely. My pleasure, and thank you for the hospitality, and I really enjoyed being part of this course. It's my honor.